Hypertension or high blood pressure is often called the silent killer. This is because it often has no symptoms, but can lead to serious health problems. It affects millions of people, especially as they age. Understanding hypertension is vital for safeguarding your health. Imagine your arteries as highways for blood to travel through your body. Hypertension is like having traffic jams in those highways. The force of the blood against the artery walls becomes too high, putting stress on your heart and other organs. Over time, this can damage your arteries and increase your risk of heart attack, stroke, and other serious conditions. The good news is that hypertension is treatable. By understanding the causes, recognizing the symptoms, and working closely with your doctor, you can effectively manage this condition and live a long and healthy life. While the exact causes of hypertension are not always clear, several factors can contribute to its development. Some factors are within our control, while others are not. Age is a significant risk factor for hypertension. As we age, our blood vessels naturally become less elastic, making them more susceptible to the effects of high blood pressure. Family history also plays a role. If your parents or siblings have hypertension, your risk increases. Lifestyle choices also contribute significantly to hypertension. A diet high in salt, saturated fats, and cholesterol can elevate blood pressure. Lack of physical activity, obesity, and excessive alcohol consumption are also linked to hypertension. Stress, smoking, and chronic conditions like diabetes and kidney disease can also play a role. Hypertension often doesn't cause noticeable symptoms, especially in its early stages. This is why it's often called the silent killer. Many people live with hypertension for years without realizing it. However, some individuals may experience symptoms like headaches, shortness of breath, nosebleeds, and fatigue. It's important to note that these symptoms can also be caused by other conditions, so they are not always indicative of hypertension. The only way to know for sure if you have hypertension is to get your blood pressure checked regularly. This simple and painless test is an essential part of preventive health care, especially for individuals over 40. Diagnosing hypertension is straightforward. It involves measuring your blood pressure using a device called a sphygmomanometer. This device consists of an inflatable cuff that is wrapped around your upper arm, and a gauge that measures the pressure in the cuff. Your blood pressure reading consists of two numbers, systolic and diastolic pressure. Systolic pressure is the pressure in your arteries when your heart beats, while diastolic pressure is the pressure between beats. A normal blood pressure reading is typically below 120 over 80 millimeters of mercury. If your blood pressure is consistently above 140 over 90 millimeters of mercury, you may be diagnosed with hypertension. Your doctor will consider your overall health, family history, and lifestyle factors before making a diagnosis. Section 5. Seeking expert guidance. The cornerstone of hypertension management. If you are diagnosed with hypertension, the most crucial step is to consult your doctor. They will work with you to develop a personalized treatment plan to manage your condition effectively. Remember, hypertension is a serious condition, but it is manageable with the right approach. Your doctor is your partner in this journey, providing guidance and support every step of the way. They will consider various factors such as your age, overall health, lifestyle, and the severity of your hypertension to create a plan tailored to your specific needs. Section 6. A lifelong commitment. The importance of continuous treatment. Managing hypertension is not a sprint, it's a marathon. It requires a lifelong commitment to healthy habits and adherence to your doctor's recommendations. Treatment for hypertension typically involves a combination of lifestyle modifications and medication. Your doctor will work with you to determine the most effective approach based on your individual needs. Adhering to your prescribed medication is crucial for managing hypertension and preventing complications. Lifestyle changes may include adopting a heart-healthy diet low in sodium and saturated fats, engaging in regular physical activity, maintaining a healthy weight, quitting smoking, and limiting alcohol consumption. Section 7. Neglecting the silent killer. Potential complications. Untreated or poorly managed hypertension can have devastating consequences for your health. Over time, the constant strain on your arteries can damage your blood vessels and organs, leading to a cascade of complications. One of the most serious risks is cardiovascular disease. High blood pressure damages your arteries, making them more susceptible to plaque buildup. This can lead to heart attack, stroke, and other cardiovascular events. Uncontrolled hypertension can damage blood vessels and increase the risk of heart attack and stroke. Hypertension can also damage your kidneys, leading to kidney failure. It can affect your vision, causing eye damage and even blindness. Other potential complications include dementia, sexual dysfunction, and sleep apnea. Section 8. The doctor knows best. Never stop treatment alone. It's crucial to understand that managing hypertension is a lifelong commitment. Even if you start to feel better or your blood pressure readings improve, do not stop taking your medication or deviate from your treatment plan without consulting your doctor. Suddenly stopping medication can be dangerous and lead to a rebound in blood pressure, putting you at risk of serious complications. Your doctor will guide you on any adjustments to your treatment plan based on your progress and individual needs. Open communication with your doctor is vital for managing hypertension effectively. Never hesitate to discuss any concerns or questions you may have. Remember, managing hypertension is a partnership between you and your doctor. Work together to achieve optimal blood pressure control and protect your long-term health. Section 9. Living fully with hypertension. A beacon of hope. Receiving a diagnosis of hypertension can be overwhelming, but it's essential to remember that you are not alone. Millions of people live full and active lives with this condition. By embracing healthy habits, working closely with your doctor, and staying informed about your health, you can effectively manage hypertension and minimize your risk of complications. View this diagnosis as an opportunity to prioritize your well-being and make positive changes that will benefit you for years to come. Living a healthy lifestyle can help you thrive with hypertension. Embrace healthy habits and prioritize your well-being. Remember, knowledge is power. Stay informed, be proactive, and take charge of your health. Together, we can conquer hypertension and live longer, healthier lives.